Question 1. A nurse is preparing to administer medications through a nasogastric (NG) tube. Which action should the nurse take first? A. Crush all tablets thoroughly. B. Check the placement of the NG tube. C. Mix all medications together. D. Administer medications with cold water. Answer: B. Check the placement of the NG tube. This question focuses on medication administration safety, and the keyword first indicates a prioritization task. Before administering anything through an NG tube, the nurse's absolute priority is to verify its correct placement to prevent accidental administration into the lungs, which could cause aspiration pneumonia. Checking placement can be done by aspirating gastric contents and checking pH, or by X-ray confirmation, which is the most reliable method. Always ensure the tube is in the stomach or intestine before instilling anything. Patient safety is paramount. Question 2. A client with type 1 diabetes asks about the best time to exercise. Which instruction should the nurse provide? A. Exercise vigorously right before bedtime. B. Perform exercise when your blood glucose is at its peak after a meal. C. Avoid exercise if your blood glucose is below 100 mg per deciliter, 5.5 millimoles per liter. D. Monitor your blood glucose before, during, and after exercise. Answer: D. Monitor your blood glucose before, during, and after exercise. This question assesses knowledge about diabetes management and the impact of exercise, with the core concept being blood glucose regulation. Exercise can lower blood glucose levels, so it's crucial for clients with type 1 diabetes to monitor their levels closely around physical activity to prevent hypoglycemia, low blood sugar, or hyperglycemia, high blood sugar. For instance, they might need to adjust insulin dosages or carbohydrate intake based on these readings. Always emphasize thorough monitoring and individualized adjustments to maintain stable blood sugar levels during exercise. Question 3. A nurse is assessing a client who reports severe pain in the left lower quadrant and nausea. Which assessment finding requires immediate intervention? A. Rebound tenderness. B. Mild abdominal distension. C. Hypoactive bowel sounds. D. Client states pain is 7/10. Answer: A. Rebound tenderness. This question tests the nurse's ability to identify critical assessment findings, particularly related to abdominal pain. Rebound tenderness is a key sign of peritoneal inflammation, which can indicate serious conditions like appendicitis, peritonitis, or a ruptured organ, all requiring urgent medical attention. While pain, distension, and altered bowel sounds are important, rebound tenderness suggests a more severe and immediate risk of widespread infection or organ damage. Always prioritize signs that point to acute, potentially life-threatening inflammation or organ compromise. Question 4. A client is prescribed digoxin. The nurse should withhold the medication and notify the healthcare provider if the client's apical pulse is less than which rate? A. 80 beats/min. B. 70 beats/min. C. 60 beats/min. D. 50 beats/min. Answer: C. 60 beats/min. This question tests a fundamental safety guideline for administering cardiac medications, specifically digoxin. Digoxin is a cardiac glycoside that strengthens heart contractions and slows the heart rate. A key nursing intervention before administering digoxin is to check the apical pulse. If it is below 60 beats per minute in an adult, the medication should be withheld and the provider notified due to the risk of significant bradycardia. Always remember that digoxin can dangerously lower the heart rate, making pre-administration pulse assessment crucial for patient safety. Question 5. A nurse is caring for a client with a new colostomy. The client expresses concern about body image. Which nursing action is most appropriate? A. Refer the client to a psychologist. B. Reassure the client that the appearance will improve. C. Provide information about local ostomy support groups. D. Encourage the client to look at and touch the stoma. Answer: D. Encourage the client to look at and touch the stoma. This question addresses psychosocial adaptation to a new ostomy and the nurse's role in promoting acceptance. Encouraging the client to engage directly with their stoma, by looking at it and touching it, promotes acceptance and facilitates the integration of the altered body image. This hands-on approach helps desensitize the client, normalize the stoma, and enables them to participate in their own care, fostering independence and adaptation. Active engagement is far more empowering than simply offering reassurance or referrals initially. It's a critical step in adjustment. Question 6. A nurse is providing discharge teaching to a client with a new prescription for warfarin. Which food should the nurse instruct the client to limit due to its high vitamin K content? A. Oranges. B. Spinach. C. Bananas. D. Chicken. Answer: B. Spinach. This question tests knowledge about drug-food interactions, specifically with the anticoagulant warfarin. Warfarin works by interfering with vitamin K-dependent clotting factors, so consuming foods high in vitamin K, like spinach and other leafy green vegetables, can decrease its effectiveness and increase the risk of blood clot formation. Clients should be taught to maintain a consistent intake of vitamin K-rich foods rather than avoiding them entirely, to ensure the medication's therapeutic effect remains stable. Always educate clients on the importance of dietary consistency when taking anticoagulants to prevent dangerous fluctuations in clotting time. Question 7. A nurse is assessing a 4-month-old infant. Which developmental milestone should the nurse expect? A. Sits unsupported. B. Says mama or dada. C. Rolls from back to front. D. Walks with assistance. Answer: C. Rolls from back to front. This question assesses knowledge of normal infant developmental milestones. By 4 months of age, infants typically develop the strength and coordination to roll from their back to their front, often as an early sign of increasing mobility and muscle control. Sitting unsupported and saying mama or dada are usually seen around 6 to 9 months, and walking with assistance occurs much later, typically around 9 to 12 months. Understanding these milestones helps nurses identify potential developmental delays early. Question 8. A nurse is preparing to administer an intravenous, 4, push medication. After cleaning the injection port, what is the next action the nurse should take? A. Administer the medication rapidly. B. Flush the 4 line with saline. C. Aspirate for blood return. D. Check for medication compatibility. Answer: C. Aspirate for blood return. This question focuses on safe 4 medication administration and next action points to the sequential steps involved. After ensuring the injection port is clean, the crucial next step is to aspirate for blood return to confirm that the 4 catheter is still patent and correctly positioned within the vein. Without confirming patency, administering medication could lead to extravasation, leakage into surrounding tissue, or infiltration, causing pain and tissue damage. Always confirm 4 patency before pushing any medication to ensure it reaches the bloodstream safely and effectively. Question 9. A client is receiving total parenteral nutrition, TPN, and reports feeling shaky and dizzy. The nurse notes the client is diaphoretic. What is the nurse's priority action? A. Check the client's blood glucose level. B. Discontinue the TPN infusion. C. Administer an insulin bolus. D. Increase the TPN infusion rate. Answer: A. Check the client's blood glucose level. This question tests critical thinking regarding TPN complications, with the keywords shaky, dizzy, and diaphoretic strongly indicating hypoglycemia, low blood sugar. TPN contains high concentrations of glucose, and if the infusion rate changes, or if the client's body is unable to process the glucose, blood sugar imbalances can occur. Checking the blood glucose level is the immediate priority to confirm the suspected hypoglycemia, as this will guide subsequent interventions like administering D50W or glucagon if needed. Always assess before intervening, especially when symptoms suggest a blood sugar emergency. Question 10. A nurse is educating a client about reducing the risk of falls at home. Which suggestion is most effective? A. Keep all rooms dimly lit to conserve energy. B. Wear loose-fitting clothing and long robes. C. Remove throw rugs and clear pathways. D. Place cords across frequently used walkways. Answer: C. Remove throw rugs and clear pathways. This question addresses fall prevention strategies, a crucial aspect of patient safety. Throw rugs and cluttered pathways are common environmental hazards that significantly increase the risk of tripping and falling, especially for older adults or those with mobility issues. Eliminating these obstacles creates a safer environment by providing clear and stable surfaces for ambulation. Always prioritize removing physical hazards in the home to prevent falls and promote client independence. Question 11. A nurse is caring for a client with a new prescription for captopril. Which adverse effect should the nurse instruct the client to report immediately? A. Dry cough. B. Fatigue. C. Swelling of the lips or tongue. D. Dizziness upon standing. Answer: C. Swelling of the lips or tongue. This question assesses knowledge of ACE inhibitor adverse effects, with report immediately highlighting a life-threatening complication. Swelling of the lips or tongue, known as angioedema, is a rare but severe allergic reaction to ACE inhibitors like captopril that can lead to airway obstruction and respiratory distress. While a dry cough is a common side effect and dizziness upon standing is expected with antihypertensives, angioedema requires immediate medical intervention. Always emphasize the importance of promptly reporting any signs of facial swelling to prevent airway compromise. Question 12. A nurse is assessing a client's pain level using a numerical rating scale. The client states the pain is 8 out of 10. Which action should the nurse take next? A. Document the pain score in the client's chart. B. Administer a prescribed opioid analgesic. C. Reassess the pain in 30 minutes. D. Ask the client to describe the pain's quality. Answer: D. Ask the client to describe the pain's quality. This question focuses on comprehensive pain assessment, with next indicating the ongoing assessment process. While documenting and administering medication are important, knowing the numerical pain score alone is insufficient to plan effective pain management. Asking the client to describe the pain's quality, example sharp, dull, throbbing, location, duration, and aggravating/alleviating factors provides crucial additional data to accurately identify the type of pain and choose the most appropriate intervention. A holistic pain assessment is always the foundation for effective pain relief. Question 13. A client is prescribed furosemide. Which electrolyte imbalance is the client at risk for developing? A. Hypernatremia. B. Hyperkalemia. C. Hypokalemia. D. Hypocalcemia. Answer: C. Hypokalemia. This question tests knowledge of diuretic side effects, specifically with loop diuretics like furosemide. Furosemide works in the loop of Henle in the kidneys, causing the excretion of sodium, chloride, and importantly, potassium. This increased potassium excretion puts the client at significant risk for developing hypokalemia, low potassium levels, which can lead to dangerous cardiac arrhythmias. Always monitor electrolyte levels, especially potassium, in clients receiving loop diuretics to prevent serious complications. Question 14. A nurse is caring for a client who is NPO, nothing by mouth, and has a fever. Which intervention is most important for the nurse to implement? A. Administer antipyretic medication as ordered. B. Provide frequent oral care. C. Offer ice chips periodically. D. Encourage deep breathing exercises. Answer: B. Provide frequent oral care. This question addresses care for NPO clients, emphasizing comfort and prevention of complications. While antipyretics address the fever and deep breathing is generally good, for an NPO client, maintaining oral hygiene is paramount. Being NPO leads to a dry mouth, increased bacterial growth, and discomfort, which can contribute to oral infections and aspiration risk if secretions are not managed. Frequent oral care keeps the mucous membranes moist, reduces bacterial load, and promotes comfort. Question 15. A nurse is preparing a sterile field. Which action would contaminate the sterile field? A. Keeping sterile gloved hands above the waist. B. Opening the sterile package away from the body. C. Reaching across the sterile field to place an item. D. Placing sterile items within a 1-inch border of the field. Answer: C. Reaching across the sterile field to place an item. This question tests adherence to sterile technique principles. Reaching across a sterile field compromises its sterility because unsterile objects or clothing can inadvertently come into contact with or drop contaminants onto the sterile area. The air currents created by reaching can also carry microorganisms. Always ensure sterile objects remain within sight and avoid turning your back or reaching over the sterile field to maintain its integrity. Question 16. A nurse is reinforcing teaching about insulin injection sites. Which statement by the client indicates a need for further teaching? A. I should rotate injection sites to prevent tissue damage. B. The abdomen is a good place to inject because it absorbs insulin quickly. C. I can inject insulin into the same spot each time if I want. D. I should pinch the skin before injecting insulin. Answer: C. I can inject insulin into the same spot each time if I want. This question assesses knowledge about safe insulin administration. Injecting insulin into the exact same spot repeatedly can lead to lipohypertrophy, a lump or thickening of fatty tissue, or lipoatrophy, a pitting or indentation of fatty tissue, at the injection site, which impairs insulin absorption and can lead to unpredictable blood glucose levels. Rotating injection sites, even within the same general area, is crucial to prevent these complications and ensure consistent insulin absorption. Emphasize site rotation to all clients using insulin. Question 17. A nurse is caring for a client with a chest tube who experiences sudden shortness of breath and decreased breath sounds on the affected side. What is the nurse's priority action? A. Document the findings in the client's chart. B. Notify the healthcare provider immediately. C. Check the chest tube for kinks or disconnections. D. Administer oxygen via nasal cannula. Answer: C. Check the chest tube for kinks or description. This question tests the nurse's response to a potentially critical chest tube complication, and priority action demands immediate problem solving. Sudden shortness of breath and decreased breath sounds in a client with a chest tube often indicate an issue with the tube's patency, such as a kink or disconnection, which can lead to tension pneumothorax or ineffective drainage. The nurse must first ensure the chest tube system is intact and functioning correctly before notifying the provider or administering oxygen, as fixing the immediate problem is critical. Question 18. A nurse is providing discharge teaching to a client with heart failure about managing fluid retention. Which statement indicates the client understands the teaching? A. I will weigh myself weekly to monitor for fluid changes. B. I will increase my fluid intake if I feel thirsty. C. I will call my doctor if my weight increases by more than 2 pounds in a day. D. I will eat more canned soups for convenience. Answer: C. I will call my doctor if my weight increases by more than 2 pounds in a day. This question assesses understanding of fluid management in heart failure, with understands the teaching as the key evaluation point. A rapid weight gain of 2 pounds or more in a day, or 3 to 5 pounds in a week, is a critical indicator of fluid retention and worsening heart failure that requires immediate medical attention. Weekly weights are not frequent enough. Increased fluid intake would worsen the condition, and canned soups are typically high in sodium, promoting fluid retention. Daily weights are crucial for early detection of fluid overload. Question 19. A nurse is administering a subcutaneous injection. At what angle should the nurse insert the needle for an average-sized adult? A. 15 degrees. B. 30 degrees. C. 45 degrees. D. 90 degrees. Answer: C. 45 degrees. This question assesses a fundamental skill in medication administration, the correct angle for subcutaneous injections. For an average-sized adult, a 45-degree angle is typically used to ensure the medication is deposited into the subcutaneous tissue layer without penetrating the muscle below. A 90-degree angle is usually reserved for intramuscular injections or very obese clients receiving subcutaneous injections, while 15 degrees is for intradermal injections. Always remember the correct angle for each injection type to ensure proper medication delivery and absorption. Question 20. A nurse is caring for a client with a urinary catheter. Which action is essential to prevent a catheter-associated urinary tract infection, CAUTI? A. Empty the drainage bag once per shift. B. Secure the catheter tubing to the client's thigh. C. Irrigate the catheter daily with sterile saline. D. Place the drainage bag above the level of the bladder. Answer: B. Secure the catheter tubing to the client's thigh. This question focuses on preventing common healthcare-associated infections, specifically CAUTIs. Securing the catheter tubing to the client's thigh or abdomen prevents movement and traction on the urethra, which reduces irritation and the risk of bacteria entering the bladder. Placing the drainage bag below the bladder is also crucial to prevent backflow, and emptying it frequently enough to prevent overfilling is important, but securing the tubing reduces urethral trauma and prevents ascension of bacteria. Always ensure proper catheter securement to minimize the risk of infection. Question 21. A nurse is assessing a client for signs of impending labor. Which finding indicates true labor contractions? A. Contractions that ease with walking or position changes. B. Contractions that are irregular and inconsistent. C. Contractions that become stronger, longer, and more frequent. D. Pain localized to the abdomen and lower back. Answer: C. Contractions that become stronger, longer, and more frequent. This question assesses understanding of the key differences between true and false labor. True labor contractions are characterized by a progressive pattern. They increase in intensity, duration, and frequency over time, and they typically do not subside with rest or position changes. False labor, Braxton Hicks, contractions are usually irregular, short, mild, and may lessen with activity. Always remember that true labor contractions show a clear pattern of progression and intensity, signaling cervical changes. Question 22. A nurse is teaching a client about a low-sodium diet. Which food choice indicates a need for further teaching? A. Fresh fruits and vegetables. B. Canned soup. C. Baked chicken. D. Plain rice. Answer: B. Canned soup. This question evaluates a client's understanding of dietary restrictions, specifically a low-sodium diet. Canned soups are notoriously high in sodium, used as a preservative and flavor enhancer, making them an inappropriate choice for someone trying to limit sodium intake. Fresh fruits, vegetables, baked chicken, and plain rice are generally low in sodium. Always educate clients to read food labels carefully and choose fresh or minimally processed foods when adhering to a low-sodium diet. Question 23. A nurse is caring for a client who reports severe anxiety and restlessness. Which nursing intervention is most appropriate initially? A. Administer a prescribed anxiolytic medication. B. Place the client in a quiet, calm environment. C. Encourage the client to deep breathe with the nurse. D. Explore the underlying cause of the anxiety. Answer: B. Place the client in a quiet, calm environment. This question addresses the initial management of acute anxiety, with most appropriate initially indicating the first step. When a client is experiencing severe anxiety and restlessness, the immediate priority is to reduce external stimuli and create a sense of safety and calm. Moving the client to a quiet environment helps to de-escalate the situation and prevent further overstimulation, making other interventions like deep breathing or medication more effective once the environment is controlled. Always prioritize creating a safe and therapeutic environment to manage acute anxiety. Question 24. A nurse is assessing a client for fluid volume deficit. Which finding would the nurse expect? A. Bounding peripheral pulses. B. Jugular vein distension. C. Decreased urine output. D. Crackles in the lungs. Answer: C. Decreased urine output. This question tests the nurse's ability to identify manifestations of fluid volume deficit, or dehydration. When the body lacks sufficient fluid, the kidneys attempt to conserve water, leading to a decreased urine output, oliguria. Bounding pulses, jugular vein distension, and crackles in the lungs are all signs of fluid volume overload, not deficit. Always associate decreased urine output with fluid volume deficit as the body tries to hold onto remaining fluids. Question 25. A nurse is preparing to administer immunizations to a 6-month-old infant. Which action is most important before administering the vaccines? A. Have the parents leave the room to minimize infant distress. B. Administer acetaminophen to the infant to prevent fever. C. Verify the infant's immunization history and current health status. D. Prepare ice packs to apply to the injection sites immediately after. Answer: C. Verify the infant's immunization history and current health status. This question focuses on safety before administering immunizations and, most important, highlights the critical step. Before any vaccine administration, the nurse must thoroughly review the infant's immunization history to ensure correct vaccine timing and dosage, and assess their current health status for any contraindications or precautions, such as a severe allergic reaction to a previous dose or an acute febrile illness. This crucial step ensures patient safety and vaccine effectiveness. Always prioritize verifying medical history and current health before administering any medication or vaccine.